Welcome, doctors. We know how demanding the healthcare industry can be, especially when it comes to managing documentation. The pressure to keep up with electronic health records, EHR, can feel overwhelming. It's taking time away from what matters most, your patients. But here's some good news: Connecticut hospitals are finding a solution. They're turning to virtual medical scribes, and today, we're diving into why this trend is taking off. So, what exactly are virtual medical scribes? They're trained professionals who remotely assist physicians by handling the real-time documentation during patient visits. Instead of you typing away, the scribe listens in, capturing the essential details of the encounter. From patient history and exam findings to treatment plans and prescriptions, they ensure every detail is recorded accurately. This means you can focus entirely on your patient without the constant distraction of EHR systems. Now, you may be wondering, how does this affect the bigger picture, like revenue cycle management? Well, accurate documentation is key to everything: billing, claims processing, reimbursements. If there are errors, you're looking at billing discrepancies, delayed payments, or even compliance issues with Medicare, Medicaid, and private insurers. But let's get into why more hospitals in Connecticut are adopting virtual medical scribes. It's a real issue, and studies show doctors are spending twice as much time on documentation as they do with patients. That leads to frustration, lower productivity, and burnout. Virtual medical scribes are here to help. By taking over the documentation work, scribes let you focus more on your patients, which means less stress and more satisfaction in your job. And speaking of patients, let's talk about patient-physician interactions. When you're stuck typing notes, you can lose focus on the conversation with your patient. That impacts trust and communication, and ultimately, patient satisfaction. With a virtual scribe, you're fully engaged with the patient, while the scribe handles the documentation behind the scenes. Another important reason Connecticut hospitals are adopting virtual scribes? Improved revenue cycle management. Errors in the EHR can lead to denied claims or delayed payments. But when you have virtual scribes ensuring that every detail is captured correctly, you're looking at fewer claim denials and smoother billing processes. In turn, that boosts the hospital's financial stability. You're looking at salaries, training, equipment, and workspace. You get the same level of support without the added expense. And when you pair that with revenue cycle management (BPO) services, you're optimizing both your documentation and your bottom line. Let's address some common challenges doctors face with in-house documentation. After long shifts, you still need to finish up documentation, which leads to exhaustion and delayed billing cycles. Plus, when you integrate these services with revenue cycle management (BPO), the billing process becomes faster and more efficient. Inconsistent documentation. Sometimes, in the rush of a busy day, important details get missed. HIPAA compliance is a must, and reputable virtual medical scribes are trained to handle data securely and in compliance with all regulations. When you work with a healthcare BPO provider, you can be sure your patient data is safe. By outsourcing scribe services to a BPO that specializes in revenue cycle management, Connecticut hospitals can streamline their operations. They get trained professionals, available 24/7, who seamlessly integrate into your workflows, ensuring that documentation and billing are efficient and accurate. Well, that's where Staffingly, Inc. comes in. They offer secure, HIPAA-compliant virtual medical scribe services tailored to your needs. Thanks for watching.
If you are looking for outsourcing services, schedule a demo today by visiting www.staffingly.com or emailing us at support@staffingly.com or call us on the number 1-800-489-5877.